Thank you. Thank you, Margaret, and welcome, Congressman. Before we get started, I think we've all learned you lost a colleague this morning. Maryland Congressman Elijah Cummings passed away, and he was elected to Congress just a couple of years before you were.
There was no fiercer fighter for Baltimore and the values of the Inner Harbor and everywhere than Elijah, and he was a tenacious chairman, as you all know. He fought fair, he fought hard. I think I read something this morning. Bill Clinton, upon arriving in Baltimore early in his presidency, looked around and said, "Now I know why Elijah Cummings does so well here." Apparently, it's a big hero's welcome, and he served the public well and was noble about it, and he will be missed.
Well, let's turn now to bipartisanship on an issue that, at least on the surface, lawmakers across Capitol Hill agree on, that drug prices in the United States are too high.
Yes.
But I guess the question is what to do about it. Now, you have a huge district in Oregon, I mean, bigger than every state east of the Mississippi. It's pretty enormous. So as you travel across your district, how often does this come up with your constituents?
It's a big issue.
What do they say?
It's a big issue. There are twin issues. One is people really crave cures. They want medicines that will actually improve their lives, ease
but
their
medicines
pain,
they can afford.
Medicines that they can afford, innovations. And the second part is they want drugs that they can afford. And so we've worked on this for some time in a bipartisan way. Sadly, that won't occur today. We were working in a bipartisan way on various initiatives. Earlier this Congress, in April, we unanimously passed the CREATES Act, which gets at some bad behavior, I'll say, by some of the companies that didn't provide samples to the generics in a timely manner. We passed legislation unanimously in the committee, hammered it out to stop pay to delay, all the shenanigans that go on.
Explain pay to delay.
Well, that's where basically a brand name manufacturer and a generic manufacturer get in cahoots and decide not to let that generic come into market for a little cash, or however they negotiate all that, or whatever the system was, or whatever. The long and the short of it is, we had the ability to stop that. So we passed that out of committee. We passed CREATES out of committee. We passed another bill in this area out of committee. We were working step by step, all unanimous. But a funny thing happened on the way to the floor, actually not very funny. The partisan politics of drug pricing rose up, and the speaker attached some items to those bills that she knew, or her team knew, Republicans did not support.
So that's why they never got a vote in the Senate.
They got a vote in the House,
right,
but we all voted against it because we knew those were policies. They knew. But that's not what the Energy and Commerce Committee did. We rose to the challenge. We passed these bills unanimously, and then they got knifed on the way to the floor. So now they're in the Senate. You know, when I was chairman, and those were the good old days. Just saying, I'm just chairman in exile now, waiting my return. We passed 148 bills, 93% had bipartisan votes, 55 became law, and of those 55, one was our full body of work on opioids that we made bipartisan. We had over 55 bills, I think 57 that we passed, almost all of them unanimously. We then rolled into H.R. 6, the Support Act on opioids. I could have won any vote any day in committee that I wanted to, most likely. But I wanted to make law, not just politics. And I know how to do politics, too. Did a little bit of that work as head of the NRCC. And the tragedy here is we're back to politics, not good public policy. The bill we're taking up today, H.R. 3.
H.R. 3.
It's had one hearing in one subcommittee where we had one witness. We were promised there'd be a markup in subcommittee, which is our tradition in the Energy and Commerce Committee.
I thought I watched a hearing on the 25th where there were 3 witnesses.
Yes, Republicans had one witness. So, we'll always have a minority number of witnesses, but you think about this. We're going to rewrite the entire framework and public policy for prescription drugs in America. We're going to put in some provisions that I think are really draconian, and even the Congressional Budget Office has now said will reduce innovation.
But the Congressional Budget Office also said it would save $345 billion over 6 years. That's real money.
And did they say how much of that goes into the pocket of the consumer? The answer is no. So yeah, I could save you more than that. You pick a number, I can get you there, but it doesn't mean the underlying policy is a good policy. So what the Congressional Budget Office says is, a result of this, you'll see 8 to 15 fewer drugs get approved in the next 10 years. Now, is that a drug that eases your arthritic pain? Is that a drug that might have solved ALS or Alzheimer's or Parkinson's? I don't know, and you don't know. None of us knows, but what we do know, and some of us believe it's actually going to be more drugs than that for a lot of other reasons CBO failed to take into account. They say up to 15 will never come into the market.
Right, they said 5%, but they also said something else interesting, because they felt it would improve health overall across the United States.
In the first 10 years.
And they said, quote, the overall effect on the health of families in the United States, it would stem from increased use of prescription drugs, but decreased availability of new drugs.
Right.
Is
right.
unclear.
So basically what you have is, we'll take the healthcare medicines we have today, we'll make them a little more affordable. That's actually something we could agree on and find a path forward. But they only look in a 10-year window. How long does it take a new drug to get approved? 1 out of 10 never makes it through, and it takes about a decade. You know, in the ACA, we passed a biosimilars provision, which Republicans and Democrats both supported. No, we didn't support Obamacare, but we did support this provision in biosimilars. I have a constituent who at age 12 got rheumatoid arthritis. 40 years later, she's taken Enbrel. She tells me it costs her $2,100 a month as a senior. But guess what? In August, we got a biosimilar competitor to Enbrel. Now, this drug has been out there from the 90s. We changed the law when ACA passed on biosimilars, and that's something we supported.
So how much did her costs go down?
Well, it just came on the market in August. It was just approved in August, so it's not, we'll find out once it gets out there and gets priced. But
is there nothing that you like in the Secretary's bill, in the Speaker's bill? Because what about the cap on patients' out-of-pocket spending and Medicare? Isn't that something that you were proposing, right?
Yes, we proposed that. In fact, we were in negotiations working out a modernization of Medicare Part D with the Democrats, and then all of a sudden it was radio silence. Why? Because the Speaker's office interceded and gave us H.R. 3. That's what happens when you go against the committee's work. And that was my point that I was leading up to. I mean, we passed 21st century cures. We completely rewrote all the FDA approval processes in the last Congress, unanimously out of the committee. And guess what? Yesterday, FDA announced they've now approved 1,171 generic drugs in fiscal year 2019. That is a record. It was a record when it was 971. And they just announced another couple hundred. So we have been able to team up on good public policy to both get more competition into the market but not destroy innovation. We all teamed up on 21st century cures. We need to take the next step. Fred Upton's working on that with Diana DeGette right now.
But so you have the markup today. So are you going to be, on this measure, is there anything that can salvage it in your mind? Will you propose amendments? Or
we have over 200 amendments.
DOA, okay. But the chances of this getting anywhere?
I've seen these markups before. Mm-hmm. You know when it's pre-baked, pre-cooked. You all watch that. How many of these do you think will get voted straight party line? I'll bet all of them. Because this was cooked and baked and presented from the Speaker's office to the committee. I don't think this is what Frank Pallone and NSU really want to do. It's not how they work.
What if this is what most of the American public, at least on Medicare negotiation, wants? A Kaiser Family Foundation poll earlier this year found that more than 80% of the American public support Medicare negotiating drug prices. The president came out in support of that when he was campaigning in 2016. I mean, he's also denying the International Price Index, and both of those are in this measure. So if he wants it, if the Speaker wants it, most Americans want it. How do you keep making the case that this is a bad idea?
I've done a lot of polling over the years. Okay, I can ask that question in isolation and get you probably even a higher answer. But if I tell you that it might result in 15 new drugs never coming to market, you might have second thoughts about it. If I tell you I'll work with you to get out-of-pocket caps on seniors, which I would, you go, okay, that's what I'm after, right? I want certainty, I want lower costs. There's a lot of this we could do together, and we're doing together, until all of a sudden it became a partisan football.
So what's
I
next?
want lower
What
drug
happens
costs.
next?
Well, I don't know. It's up to the Democrats because they control the agenda. We still stand ready to work like we were until they quit communicating with us. All right, so I'm frustrated. We don't have to live in this land of chaos in legislative policy making in Washington. I proved that when I was chairman. They were working with us on these other bills until they no longer were able to. And here we are in a pothole. Why? Because the American people I want lower drug costs. I mean, I look at EpiPen and how we got ripped off. My wife used to use an EpiPen. She didn't have to have it, but when it went from 100 or 175 to 600, and the CEO was making bazillions, and the chairman of the board made even more, and there was no competition, we said BS on it. And guess what? We rewrote the law on the FDA approval process for medical devices in the last Congress that said if there's no competitor to a generic, you go to the head of the line if you've got competition. Guess what? We now have a competitor to EpiPen. All right? So they want to put us in this political box. Oh, we're for high drug costs. That is total BS.
So you're saying this is all about 2020?
I'm saying this is all about 2020. And it didn't have to be this way. Does anybody, the Senate's already said they're not taking up this bill. You know, we passed Purple Book.
So this is an exercise in futility.
This is an exercise in partisan politics. And the American people will suffer as a result. If you want to do something about drug prices, we're all in. But we're not going to be all in if we know that it's going to result in less innovation. No industry invests more in R&D than the pharmaceutical biosimilar industry.
Does it have to result in less innovation? Can there be savings?
No, it doesn't have
found
to result.
elsewhere?
Yes, of course.
They say, what is it, 40 cents out of every dollar that's spent on a pharmaceutical doesn't go to the pharmaceutical companies. It goes to the middlemen, to the PBMs, to the wholesalers. I mean, I know
absolutely.
the president was trying to take that on. Can we take another whack
There
at
is
that?
so much we can do in this space. I mean, if I'd stayed on as chairman, the high cost of health care would have been our agenda. And it would have been more than just picking on one industry, right? I mean, I was on a hospital board. I owned my own business. We paid 100% of the insurance for premiums for the people who work for us. I've been on every side of this table. And I'll tell you what I've learned of late. Look at what we're doing on surprise medical billing. Frank Pallone and I are joined at the shoulder, hip, and ankle on this deal. And the private equity firms and others are spending $60 million attacking what we're trying to do. They're buying practices, taking them out of network, increasing the billable charges by 96%. 1 out of 5 people when they go to an emergency room in America now are getting stuck with a surprise bill. This is how you bring... And turn off the mic. This is how... Wow. I didn't know Pelosi had control of that. But there are things we can do here to make healthcare more affordable. I'm not a big fan of the International Price Index. Mm-hmm. Now, I know the president's put that out there as an idea. Right. They're floating it around. I actually have an amendment that says, fine, then let's apply it to all healthcare. Because guess what? Drugs are expensive, yes. Mm-hmm. You want to compare international, you want to bring costs down and socialize our healthcare system, starting with drugs? What's it cost to go to a hospital in Europe? What's a doctor get paid in Europe, or what do they charge? So if you want to have this debate, let's have the global debate here about the whole thing. Why are our deductibles so high in health insurance, and why don't they cover these drugs? We should be having the insurance companies in to answer that. I mean, I've got a colleague who I think will say today her daughter's going off her insurance. She's type 1 diabetic. Her insulin is not covered by her employer's insurance.
Incredible.
How does that happen? So see, my point is, there is so much we could do here. We went after the EpiPen scandal, and we dealt with it in a bipartisan way, and that is now law. We went after cures.
Are there any options? Are there any other options? Say, what about Grassley-Wyden?
Well, they have to. There are some interesting principles there. In fact, we will take some of those in some of our amendments today. And there's things we could work out, probably with Grassley-Wyden. I know the White House has been working closely with both of them. They're both serious legislators. There's things we could get done. But they have to get their bill. I don't know if it's fully written yet. The Senate Finance Committee does this thing where they mark up in rainbows and butterflies and theories, and then they actually write the language.
Is that how it works?
That is how it works. Yeah, they mark. You all know this. They mark up in sort of concepts, and then the actual wording gets done later. It's the only committee that does that. And they had a very tight vote even getting the bill passed initially. So, I mean, there's a long process in the Senate before we see what, I think several Republicans said they voted out at committee, but it would require substantial changes. So it's still in flux over there. But what I do know is this bill will be a partisan bill. And a bunch of Democrats wrote to the Speaker of the House recently and said, please don't do this. Let's do bipartisan work here on drug pricing. But today will, unfortunately and sadly, not be that day, and the American people will not see progress.
Congressman, before we take, we may have time for one or two questions. I wanted to ask you, do you think, considering what the House has on its plate right now, the impeachment inquiry, that anything will be passing of any consequence, whether it's prescription drug pricing measures or anything else that would really...
I'm not very optimistic watching what's happening. I've been around a while, as people know. You watch these sort of storms build, and it gets in the way of progress and policy. I mean, our surprise medical billing legislation, we passed it in July out of committee. The floor yet. We're working on it. I think there's a deal to be had there, but it hasn't moved yet. We've got a bunch of things. I was with my community health centers last week in my district. They're saying, when are you going to do the reauthorization and funding? I'd like to see 4 or 5 years. I think there's agreement to do that, but it hasn't moved yet. There are a bunch of these extenders that are running out. How do you hire people if you don't know what your budget's going to be next year that need to get done? And so it just feels like everything's getting bollocksed up, and we're out 2 weeks in October, 2 weeks in November. We don't know the December schedule yet. Some of this has to be done by year end. We don't have any appropriation bills done yet. I mean, yeah, it's kind of a train wreck, if you want to know the truth. But I get back to my point. There's a lot we could be doing here. We are fully committed to bringing down the price of drugs in a way that doesn't spike innovation or deter investment in it, because I think that'll be if the Pelosi bill were to become law, I think you'd see a shifting of investment. You'll have certified smart investor folks, I think, later talking about their views on this. But we don't need another sleeping pill. We don't need another ED drug. We don't need the one-offs that make a lot of money. Mm-hmm. We need to find cures to something like Alzheimer's that every 65 seconds somebody's diagnosed with. It's going to cost us trillions in the future.
Let's take a quick question from the audience. And if you would, stand up and identify yourself. And let's see. We have
They do have coffee in the back. We've put you fully to sleep.
All right. Well, Congressman, I guess it's going to be up to me then. So,
wow.
What is your hope then as we look forward?
Well, my hope
shows the most promise?
Yeah, my hope is we get this out of our system. Mm-hmm. I know they have to go move this bill and get it done, and then we can get back to real legislating and tackle the American people's problems. That's what they send us here for. They know we have differences of opinion and philosophy, but they really do expect us to put down the political swords and do big things. We're capable of doing big things. And the energy and commerce under Republican and Democrat leadership has done big things. And so I remain, believe it or not, optimistic we can if they're allowed to, because I know Frank Pallone well and Anna Eshoo and others, and they're serious legislators. They want to get things done, and they'll back this bill. But in their heart of hearts, they got to know it's dead on arrival in the Senate.
And is it the Medicare, the negotiating, is that the poison pill? I mean, it works for the VA, works for Medicaid.
So let's talk about the VA.
A lot of people wonder why, and we don't, why
so
it wouldn't work.
So interestingly enough, you have about 7 million people in the VA system. They have a very strict formulary, and they actually have escape hatches in that formulary, so that if you want a drug that's not in the formulary, there's an appeals process you go through. This bill does not have that. So if you're a veteran and you're locked in a tight formulary, and it's pretty much it isn't the blockbuster drugs that are in there, I'm told, although some probably are. Your physician says you need this drug, it's not in the formulary, there's a way to go outside the formulary. This bill does not give the rest of us that opportunity. When we passed Medicare Part D, remember the Democrats fought us tooth and nail. They wanted to lock the premium in statute, which would have made it significantly higher now than it would otherwise be. They didn't believe in market forces, and they wanted the government to negotiate. But let's talk about this negotiation in H.R. 3 for a second. So what it says is you're going to have 120%, you can go up to 120% of the International Price Index. And then the secretary can come in anywhere under that. So you just invented a drug and you're selling it elsewhere. And if I understand the way this works, I'm the secretary and I say, that's great, you're selling it for $120 in England. I'm only going to pay you $50. And you go, I'm not going to do that. Yeah, you are. No, I'm not. Yeah, you are. No, I'm not. Okay, you're not? Okay. Then I'm going to start assessing your revenues 65%. And within 3 years, I'm going to get it to 95%. That's what's called negotiation, Soviet-style, government-run H.R. 3 Pelosi. You think that's negotiation?
Well, amendments could change that, couldn't they?
Well, a lot could change that. But the long and the short of it is what you're going to do, and then inflation caps, we believe are going to drive higher entry into market pricing. Because if you know you're capped forever, you're going to launch that drug at a much higher price. And some of that's going on today, and we need to be looking at that. But I think this will only exacerbate that, because if I only get one shot to launch the drug, which I will, and after that I'm locked at inflation, I'm going to do probably two things: launch high, and I'm going to raise every other drug price to the inflationary cap, because I'm limited on these other ones where I really make my money. So I think you're going to see actual price increases in the others. And then I think you're going to see one-offs that don't really do much for humanity, but do inflate the wallet of those who make them. And if you're a rare disease, you look at this challenge we're having with a basic childhood cancer drug that children are no longer able to get.
Interesting, right.
That Teva quit making, I think it's Teva quit making, or Teva, and Pfizer's trying to catch up on right now. What happens if Pfizer says, we're done with this too, government? We're losing money on it, and under this negotiated thing, we're out of here too. Who makes it next? And don't you think some of that we ought to think through before we ram through a bill that's had one hearing and one subcommittee with one opposing witness, basically, because we all want to get drug prices down.
It's a lot to think about. Congressman, thank you so much.
Yeah, thanks for being.
Really
Thanks for letting me be here.
Thank you.